Welcome. My name is Michael Waniger. I'm the president and CEO of Hibiscus Children's Center here on the Treasure Coast. And today we have a wonderful panel here to talk about a special event that's happening this month. It's Child Abuse Prevention Month. And to help us talk a little bit about what that means and how you can be involved, I have two special guests from our staff today. I have Carolyn Beal, who's our Director of Mental Health Services, and Tracy Savoya, who's our Director of Marketing. And Tracy, let's just start with you a little bit and tell how this happened and what goes on. And this is kind of it's an exciting time for a serious subject.
Yeah, you're absolutely right. I'm glad to be here this morning, and this is a really important time for Hibiscus. April is Child Abuse Prevention Month, and this is really, it's all about what we do. We take care of kids, we protect children, we help save lives. If we can be at the forefront of issues and challenges that families are having and help to prevent any abuse from manifesting, that's such an important service that we can provide, which we do in our Supporting Families in Crisis, our prevention program, which we've had for many, many years. It's taken some transitions and changes over the years, but it's always been part of our core mission. And this month we commemorate so many children that have been tragically touched by abuse and so many child deaths. You know, we read about it in the paper and we all know it's a really serious and tragic subject, but what we want to talk about is the good news, is that there's so many great services, which Caroline's going to delve into the mental health and the ways that we're giving children hope in our services that they can recover, that they are important, that they are worthwhile, and regardless of what's happened to them, they can have a bright future. And I think that's really what we're here to talk about and share with the community. And I've been with Hibiscus 15 years this summer, so I've seen a lot of changes, heard a lot of tragic stories, but so many wonderful stories too of children overcoming and really having a productive life and future, that we're helping them build that foundation for the future.
Great, well, thank you. I think it's important for our audience to know that you've been here 15 years with Hibiscus. Yes. This year, Hibiscus is celebrating its 30th year here on the Treasure Coast. And for some of our new people who are moving down, because I know the economy is getting better, we're getting a lot of people moving to the area, which, in fact, the month of April, as I've noticed, there's a lot of people now heading back north. So before you go back north, I would like to sit there and encourage you to get on our website. We're going to talk a little bit about that. But again, our mission is to help abandoned, neglected, and abused children who, quite frankly, had no place else to go if there was no Hibiscus. We have a shelter that started in 1985 down in Jensen Beach, and then the village, which is the teenage children. But our programs have evolved through the years, and it's interesting to see that Hibiscus has always been on the cutting edge, really, on being proactive and how we can work, because what you said is kind of the result of domestic violence, sexual abuse, and they all get tied back into mental health somehow, some way. Right. And I'm really, really pleased to introduce Caroline, who was here a year ago, and talking about what her and her staff does to really prevent a lot of these tragedies, and what you do is so important. And if you could kind of share with the audience a little bit of your background and kind of explain what programs you're currently working on, because what you're doing is remarkable. You're doing miracles every day.
Oh, wow. Thanks, Michael.
Yes.
Well, I'm the Director of Mental Health. I've been at Hibiscus for a year now. I'm really proud of my staff. The clinicians that work in our mental health programs, they do such a great job providing services to victims of sexual abuse, physical abuse, domestic violence. We have a program which is the Sexual Abuse Treatment Program. We treat victims of sexual abuse. All the clinicians in that program, they are certified to treat those victims. So they have a lot of training and experience working with victims. And we also have the Community Mental Health Program, where we see kids in the community. And they might be also victims of abuse of some sort, physical abuse, abandonment, neglect. And then we have the Infant Mental Health Program, where we treat the parents or the caregivers and the child, trying to promote healthy attachment, bonding, and provide some behavior modification techniques, things like that.
Terrific. Well, again, Hibiscus Children's Center is on the Treasure Coast, which includes Martin County, Indian River County, Okeechobee, and of course right here in St. Lucie County. And of course the Mental Health Services offices opened up just a few years ago. And in fact, Tracy and I, we've moved here to Fort Pierce office. We join you, And it is interesting when you come and see some of the families and some of the children and see some of the wonderful things that you're putting together. For those who may not be aware of the fact that Hibiscus Children's Center basically is a nonprofit. We're a 501c3. It takes about $7.5 million to keep our organization solvent each and every year. We get some grants and some state funding through the federal government, but basically we do about $2.5 million in terms of bequests, in terms of grants, fundraising, events, special events, and of course we do an annual campaign. But the month of April is really, really critical because, again, it's one that we focus, again, on what is a national program, is Child Abuse Prevention Month. And can you kind of help me a little bit with, I know you've been here 15 years. I was on the board for a couple of years. I've been the CEO. I've been privileged to be the CEO the last couple of years. But how this got started and what people in the audience sit there and say, gosh, I just heard Caroline talk about all the wonderful things. How can I get involved? Because we need everybody.
Right, you're absolutely right. We do need everyone. And I'd say probably the strength behind Hibiscus, there's so many, but if I had to pick one, is the people. It's the staff, it's the volunteers, it's the community coming together. And when Hibiscus really came about 30 years ago through our wonderful founder, Levon Tilton, that we've talked many, many times and written about, so I'm sure people in the community have heard her name, and she's still active with us 30 years later.
She is.
Yeah, she's just amazing. When she had that dream about putting together a shelter for abused children because there was nowhere for them to go. And she has said many times, I never realized that this dream would become helping thousands and thousands of children, you know, throughout the years. It just started with a 12-bed facility in Martin County. It was just a safe place with some beds that said, okay, now children are safe. But I think one of the great things about Hibiscus is we looked at what's the next step? What can we do for children next? Sometimes society dictates what is needed, what's going on with trends, and even into the child abuse and child welfare. You know, we kind of follow that and we say, okay, it's several years later, we need to add different kinds of services that are helping the children overcome these challenges. Because like anything, you learn and you grow. Even when we built the village, which was 15 years after the shelter opened in about 2004, it's been open now a decade for our teens. Again, we're growing and finding out this is what's happening with teens. This is what the services they need. We've come across many children that have been involved in human trafficking, which in the last few years has just kind of come a buzz in the media, and people are beginning to learn about it. And I know that's something Caroline has a lot more expertise in. But so then we've added programs and the specialized sexual abuse, you know, counselors that you're talking about to meet those needs. So over the years that I've been here, and even before me, I know those trends have always taken place, that this is what the children need. This is how we'll grow. And really, at the crux of it has always been the people. It's the trained staff that are able. The counselors are master licensed clinicians. So we have these incredible high-quality staff serving the children. We have these volunteers coming in for no other reason than I just want to give my time, I donate, I bring my resources and talents, and I want to change these kids' lives. And we have incredible people that help us with incredible backgrounds that come to us from all walks of life. And the community as a whole, we would not be here without this community, the whole Treasure Coast. Over about 50% of the children come right here from St. Lucie County throughout our program. So even though our facilities may be in our neighboring counties, we have always been, you know, very centralized in St. Lucie with our services and helping to make a difference. And we've gone through a lot of changes and evolutions over the years, as probably any business or nonprofit does. But it's, to me, it's always come back to the people, that they've supported us, they've made a difference. You had said before about, we could talk about how people can get involved. Everybody can bring something different to the table. Some may want to work directly with children, be a mentor. You know, you don't have to be a teacher just to help a child. Maybe you're good in math, something like that. Our teens' education have been so disrupted because of their move from foster home to foster home, or when a child is living in this chaotic domestic violence situation, probably education is really the last thing on their mind. They're just trying to survive. So this is such an important area that we can help them. It's the foundation for their future and what they can do. Our career preparation for our teens at the village, our volunteers can help there. Of course, we go through background checks for anybody that wants to work with the kids in the facilities, but some people don't want to work with the children because that might be a little too emotional, and that's okay too. So you can work in fundraising. I would just say bring whatever talents and skills you have to us. Let us know what your interest is, and we'll find a place for you. And probably one thing every person can do is be an advocate for the kids. Go out to the community. If you're not familiar with Hibiscus, visit the shelter or village with us. learn, and then go back to your community, because everyone has friends. People go to church, they play golf, they work somewhere. They're going to reach people we would never reach, even though we constantly try to be in the paper, send out letters, but you can't reach everyone. So be advocates, for the kids in your world as you move on, as you go up north. Still tell them back in Florida, I support this wonderful organization, because now we have a website. It's so easy anywhere in the country. You could just log on and, check out it's hibiscuschildrencenter.org. So it's very simple to remember, and everything about our programs, how to donate, our special events, anything about Hibiscus. It's kind of a one-stop shop for what's going on in Hibiscus's world. And visit us and you can learn more.
And that's something I think a lot of the people that we talked about are moving into the state of Florida. Actually, we're now the third largest state in the country. My understanding is New York's moved here, so they're now we're third, and New York is fourth. That effect. And again, this month I do see a lot of traffic heading back north. So one of the things that the state of Florida, obviously, we're not too proud of is that, unfortunately, we are the third largest in human trafficking. And this is a phenomenon a lot of people don't really want to know about it. Let's out of sight, out of mind. But it's a fact that's happening in today's society. Last month, we had the opportunity to have our State of Hibiscus 2 right here in St. Lucie County. And we had some dignitaries for the state of Florida that came in. We had Kurt Kelly, who is the president and CEO of the Florida Coalition of Children, which we had Carol DeRoche from Devereaux, who's our community-based care organization for the same 4 counties, Mike Carroll, who's the secretary for Department of Children and Families. And I found it very interesting because the audience was obviously informed, because even people who have been here a long time still think, oh, well, you're a residence, you're a shelter for children, you feed it, but they don't understand the programs and what we do. And again, we try to give back to the children some sense of normalcy, if there can possibly be that. And the programs that we've tried to let people know that have evolved recently is, as you mentioned, the sexual abuse treatment program. There's 15 in the state of Florida, which we constantly look as one of the tops about results. The infants, I think, is really, that one, some of this stuff, I tell the audiences a lot of times, give me 2 minutes and I can make you cry. And it's not my intention to do that today, but you can't help it. I mean, these children are victims, and we have an opportunity. And the staff you were talking about, I'm so fortunate. I have 150 full and part-time staff members and 350 volunteers. People volunteer in various ways, as you mentioned, their time or their treasure, and just advocacy, letting people know I'm just so heartfelt when I sign a letter back and somebody's from another part of the world and said, I want to sit there and give some money to Hibiscus because what you're doing is so important. And that's what was going on. And again, these programs that Caroline and her team are putting together are so beneficial to this community. We can't put our head, under the sheets and say, gee, it doesn't happen. Right. No, this is life. But the positive things that are happening, and I know you see them every day, and you might want to expound a little bit on what type of people come in. They're not always necessarily, it's to the point where they've got problems, but they're maybe on the threshold of getting there.
Right. Well, it is Sexual Assault Awareness Month. Last week, my staff and we participated in the Walk in My Shoes event, Lauren's Walk, and that is to spread awareness of sexual abuse and through prevention and education. 95% of the sexual abuse cases are preventable, and healing happens. So that's why I say I'm so proud of my staff, because they are truly passionate about what they do, and it takes that type of person to really work with the victims and their families to promote the healing process. So we do get a lot of cases, unfortunately, where they are victims, but through that healing process, they become survivors. So we had a case where a girl came into the shelter. She had been sexually abused, and she got therapy through the SATP. We are the only one on the Treasure Coast, one of 15 in the state. And this girl was able to be reunited with her mom, but before that happened, the mom was a part of that healing process too, where the girl shared her story with mom, and eventually they had safety precautions, and planning for the future, and Mom was aware of what was going on through education. So hopefully that will be preventable in the future to prevent any further victimization through that program. So that I could say is a success story. So although we might see them as victims in the beginning of this process, at the end we hope that they become survivors of sexual abuse and promote awareness within their own families and their own communities.
Right.
So.
I think the key word of that is awareness. Sometimes it becomes generational. What was accepted in past generations is not acceptable today. And again, this is some of the human aspects that we touch. As I said beforehand, Hibiscus has been fortunate enough. We've had over 250,000 safe nights for children over the last 30 years. And behind every one of those numbers, I say there's a child. And behind every one of those children is a story. And everybody's story is somewhat unique. And the wonderful things that you and your staff are doing to assist in today's world, I think, is just remarkable. Unfortunately, we don't get enough press from it. And I'm not going to blame Tracy, because Tracy gets blamed for any time, oh my gosh, we need more stories, we need more stories. And again, the websites that you do, the media picks up on it. The different agencies that we are with the Alliance and the partnerships, such as the Children's Services Councils that we work with, helping kids after school when they have that downtime. As our society has changed, and it has changed, obviously the needs of society has also needed to change. And that's why we're on, again, the proactive side of let's not be reactive. Let's not wait till we have a problem. Let's sit there, try to identify, create the awareness that you're talking about, so that we can sit there and say, wait a minute, this is not acceptable behavior. This is something that happens, and I've learned so much from it, coming even from the private sector in the corporate world. I do not have the background, I do not have the education that you have to recognize that. So it's an interesting dichotomy to sit there and see how families can become families again. I mean, getting back to the core values by understanding some of that. And I know, Tracy, we deal a lot with we did with our annual campaign. I mean, under your leadership, the last couple of years, we put together our annual campaign and our where we had no pictures of staff. And I said, I don't want to do that. We have really no names of the donors, although we need all the donors and all the assistance that we possibly can to keep us going. But it's always about the children. And I'm constantly reminding, whether it's community, whether it's board members, whether it's volunteers or whatever, if you're here for any other reason other than the children, you need to reevaluate it. I mean, it's nice we throw lavish events and we do fundraising to do that, but the core is, and my default mechanism for any decision I ever make is, what's in the best interest of the children? And I think this is where we have to constantly be focused. We do a lot of wonderful things in the community, and Levon Tilton is, as I refer to her, as a walking saint. If you've ever, she's our modern day Mother Teresa, as far as I'm concerned. She's just phenomenal, and you're it. You're in charge of all marketing for 4 counties, and I know that you don't have much to do as a result of that, but I'm teasing you, of course, but it's amazing how important it is to get this message out. And one of the ways we do it is through programs like right here with WLX TV. So kind of share a little bit how we can do this, because I knew when I was chairman of the chamber here in St. Lucie County, we were the 3rd fastest growing county in the country.
Right.
Now the economy took a little doldrums, but we're moving again. Right. Things are moving, and I mean, I see the businesses coming in, I see the real estate people moving in, the development's happening, and so when all of these opportunities come in, these people who are moving here want to know, how do I become part of the community? And the good way to start is becoming a member of Hibiscus.
Right, and we probably couldn't stress strongly enough that everybody can be involved somehow. Sometimes people think I don't have a lot of finances to give, or I don't have a lot of time because they have children, I work, but everybody can do something, and I'll repeat what I said, that you can be an advocate or an ambassador for the children. No one probably has time to sit for hours and hours and hear every single thing we do, so we try to publicize a lot in the newspaper across the Treasure Coast, writing stories about the children, the programs, the events, our wonderful board members in St. Lucie County. We've been sharing about them in the paper, all these different walks of life coming together to build this wonderful board that advocates and fundraises for the kids, but we'll never be able to get the word out to everyone like we said. So if I could encourage the community, if the one thing they could do is contact us, even if you know about Hibiscus or this is the first time you've ever heard, call us and find out. Everybody has a passion somewhere, and someone may have heard something that Caroline had said, I never knew that they have those kind of services in this area. They may be a family that are in need of help. So call us, or you may want to support. Call and find out how we would utilize your finances, your time. There's just something for everyone, and find out the needs of the children firsthand, and then go out and advocate for us. We'll continue to put things in the paper, do our annual reports. Social media is a big thing these days. We're on Facebook, we're on Twitter. Please follow us, because then you can share that with your friends. We do all kinds of mailings. So we'll always keep every effort and communication we can going, but we need the community's help so much, not just financially, although that's a big part, but we need their advocacy for the needs of the children and what programs are available to help families here in St. Lucie and across the Treasure Coast.
You mentioned another program that's unique to St. Lucie County, actually, and it's nationally renowned, is supporting families in crisis. We have 2-3 people on our staff that are miracle workers, amazing. Yeah. They have like a 99% to keep people out of the programs. Where, for example, let's say somebody in their family lost their job, or all of a sudden they've been evicted, or they've got a baby, they don't have formula, their lights have been turned out, all these types of things. Contact us through the Supporting Families in Crisis program. Mm-hmm. That's one way we can do, again, to alleviate before some of the real tragedies develop. Mm-hmm. And those are, an ounce of prevention is worth a pound of cure, as they always say. Right. One of the programs I know that you're working on, that we're looking to do too, is with our referrals with all the mental health services, because sometimes when people hear certain words, there's a stigma attached. Mental health, oh my gosh, maybe there's something wrong, or I mean, from the standpoint that I don't want to go near that, or this type of thing. It's basically a condition of understanding who we are, where we are, and where we live in, and how we fit in society. Mm-hmm. And I have the opportunity occasionally now, since I'm up in this office a little bit more, is to sit there and listen to some of the some of the stories that go on, and how you all talk among yourselves and create solutions, right, which I think is really important for us to do.
Well, we get a lot of referrals from the schools, the community, dependency system, doctor's offices. Mm-hmm. So sometimes a family comes in and they might be on they might be at risk of losing, their house, or they're stressed out. Mm-hmm. There might be a lot of things going on in the home. So when they come in, we can assess them, and we can refer them to programs like Supporting Families in Crisis. And then we can work with those family advocates in Supporting Families in Crisis as a whole, and work with the family to provide the mental health services, whether that may be family therapy or individual therapy. And we can see them at their home, in the school. They can come to the office, and the family advocates go to their home, meet with them, and assess what their needs are in terms of prevention. Mm-hmm. So to prevent their family from going in the dependency system, or losing their home, anything, becoming homeless. So mm-hmm. We really all work together. So I can't say stress enough how much our clinical team and the family advocates, everyone at Hibiscus works so closely together. We're a great team.
And I did want to just clarify one thing, so that the audience is say, oh my gosh, when we talk about and when we do pictures and everything, we change names. Confidentiality is paramount. So no one ever has to fear that, if I call and find out, somebody may know, or something to that effect. We talk, we change names, we do different pictures of other children, if you will, so that we're very respectful because that's a time when people are going through crisis. That's the last thing they need is any more embarrassment or humiliation that they may consider that they found themselves into. So when we talk among ourselves, we could say little Sally or little Johnny, or in fact we had a whole campaign on little Johnny, and I don't think little Johnny ever existed, but I do remember little Johnny at one particular time. And these are things that we do so we can sit there and get a point across to the audience and say, these are the types of things that we can do. And we've got probably just a couple of minutes left this morning. Where can we go from here, Tracy? I mean, if you're in the audience and somehow, hopefully, we've reached some people in the audience say, you know, Hibiscus sounds like a wonderful organization. I need to know more about them. I'd like to get involved to whatever level. How would you encourage that to happen?
I would ask people to visit the website. I think it's the easiest thing, and it's hibiscuschildrencenter.org. Learn more about what's going on, and as I said before, how someone can be involved. What's their passion? Somebody, you know, when I hear Caroline talk, I think, you think what's relative to you. I have 3 teens at home, and I think about there's so many issues kids face today, bullying, and they have friends whose families are sometimes just in a lot of stressful situations and domestic violence they encounter, and things just our own teens tell us about, as well as when I hear you talk about the programs. There's so many things our families are faced with today, so that there is a resource, there is a place for hope, and we may not have all the answers to everything, but I know the programs are terrific about working with other nonprofits. We're great at collaborations and partnerships, and that's what makes this Treasure Coast community so special. And I know Caroline can speak to this way better than I can, but call us and find out how we can help, or how you can get involved, because like Caroline said, you may be hearing about a family that the specialized sexual abuse counselors and the symposiums you're attending and the training and the counseling, people may not realize there is such a need for that. I mean, that is a very, very serious issue that our children face. These are little children. You know, these are teens, these are kids starting their lives with this tragic beginning that no child should have to face. No person should, but certainly no child. So there are things that are going on that maybe people don't even realize just because they're not informed, they're not, you know, in this area or this field. So learn more and educate yourself, and that could be an area you may find you have a passion about. I want to make a difference, and then call us and find out, you know, okay, I'm here, I want to make a difference. Now what do I do? And we're so happy to talk to anybody, you know, and kind of steer you in the right direction of what works for that person.
I think a lot of the times the families too, they need to become more involved in the community. A lot of times they are staying silent, isolated. They don't talk to their neighbors. You know, everything's kind of hush hush. So we want, you know, even if there is something that's going on in the home, we want to be part of the solution, not part of the problem. We want to help them. So when they come in, we're not judging them. We want to offer them help and be supportive, non-judgmental, and refer them to other agencies if they need other services. So it's going to take this whole community to promote prevention and awareness. So.
And the mental health collaborative that we have put together here, I think, is really important, because I do remember just about a year and a half ago, we only had one licensed therapist, and I think what he got 7, 8, 9, somewhere like that now, which is, I mean, which is a good news, bad news story. I mean, it's great that we have that many more resources that we can offer the community, but that we didn't have, and it only comes because of the generosity of the people in the community pulling together, and this is a community task. I can share one thing with the audience that I've had I haven't had 15 years of experience, but I've had close to 4 and 4.5, either as a board member or as the CEO. The one common denominator that brings us all together, whether you're staff, whether you're a volunteer, whether you're a board member, is the passion for the children. And as always, end every event or every meeting is, where would these children be without Hibiscus Children's Center? So I thank you for what you're doing and what you continue to do, and I encourage our audience to do the same. Thank you.
Thanks.